And welcome to our Farm to Home segment. We're so glad to have Thomas McDowell, pharmacist and owner of Rocky Mount Medical Park Pharmacy located in the Boyce Willis Clinic building. So glad to have you this morning.
Glad to be here again, Sandra. Appreciate you having me.
I keep saying this, but I get so many good comments because of your topics. You always seem, I'm wondering when he's going to run out. I don't think you are.
Well, always trying to think of something new and relevant and even seasonal,
yes,
if possible, because that's what everybody's thinking about is what's going on right now. And so today's topic is definitely relevant to this time of year, and it's going to be about ticks and tick-borne illnesses, treatment and prevention. And so spring, summertime, ticks are out. That's prime time where you're going to see tick bites.
Yes.
Great time of year weather-wise, but it also brings out some bugs. And ticks are one that you might not think about all the time, but they can cause some pretty severe illnesses. So we're going to dive into what some of those illnesses are, and how to go about treating them and preventing anything serious. But just as far as getting a tick bite, most of them really come from just your backyard.
Yeah.
Just walking around in the grass.
Grass.
Yep.
I mean, everybody's got grass.
Yep. Any vegetation, grass, or anything like that, you're going to be potentially susceptible to having a tick crawl on you.
Yeah.
They're in the grass. They are looking, for
Absolutely.
for a meal, basically.
That's right.
And so they're going to, if you're walking around in an area where there's a tick, and there's a good chance they'll get on you. And so how do you know you've been bitten by a tick is where we will
That's
start.
That's a good question.
Usually you're going to find them is the most ideal scenario, because then you can go ahead and get them off before they've been up
Right.
on your body for so long. They attach to you. They then feed on your blood. It's not pleasant, but that's what happens. And so they when they're full, they fall off, which can be several days.
Wow.
And so you really want to find them immediately. And so another way, if you don't have if you don't find the tick, sometimes they'll fall off. You usually will notice a bug bite, and usually more swollen and red than just a mosquito bite.
Right.
But they can be hard to differentiate from spider, mosquito, other bugs. You might see two little indentations where they were feeding. But most of the time we find them. They like to go behind the ears and
in the hair.
They start on your leg. Sometimes they'll attach to your leg. But a lot of times you don't feel it.
Right,
You
and
might,
that's the unfortunate thing.
That's the difficult part. You don't feel them getting on you, and you don't feel them attaching to you, usually. So it's after the fact, and we'll talk about some ways to prevent them even getting on you to begin with. But once they're attached to you, the longer they're on you, the more chance that they might transmit bacteria to you, and that's usually what the risk is with the tick bite, is the bacteria. There's always typically going to be a little bit of redness and irritation, but it's if they pass along something more severe. And so one that most people know about, Lyme disease.
Oh, yes.
So that's caused by
Scary.
bacteria, and it's called Borrelia is the bacteria that causes Lyme disease. So it comes from deer ticks or black-legged ticks, which are in every state. So it's not just regionalized. And there's about 300,000 cases annually.
Wow.
So it's pretty
That's a
common. Pretty common. And some people are fine and they're treated and they don't have any significant illness, but sometimes it can be very severe, especially if you don't catch it. And it's actually nicknamed the Great Imitator because it imitates so many different diseases. Very broad symptoms that can be confused with other illnesses. It can cause over 300 symptoms. So it's very difficult to pinpoint unless you know that you've been bitten by a tick.
Yeah.
So it's often misdiagnosed. And so being aware that you've been bitten and communicating that to your provider is key in the treatment process. Another one, Rocky Mountain spotted fever. That's transmitted by the American dog tick, and the Rocky Mountain wood tick and the brown dog tick. And that one can be pretty severe as well. And so a lot of people are probably wondering, I get bit by a tick, am I in immediate danger?
Right.
Typically, no. Usually you're just going to have a little bit of irritation, and you can put a little hydrocortisone cream and clean the area with soap or alcohol, and it'll go away in a few weeks.
So hydrocortisone cream.
Yep.
Okay.
So hydrocortisone cream will get rid of some of that redness, the itchiness, and get rid of some of the swelling. And then also making sure you clean it well,
right.
because
sure.
That can, even if they're not passing on Lyme disease or Rocky Mountain spotted fever, but there's other bacteria that they can pass that might give you kind of a low-grade fever and make you feel under the weather. So as far as Lyme disease, the amount of time that it takes to transmit, this is a good thing if you can catch it quick enough. It's usually 36 to 48 hours until there's a high risk for transmitting Lyme disease.
That's not very long.
Yeah, so you want to find it right after you're out and about.
That's why it's important to check yourself. Check your hair and behind your ears and your legs, like you said.
Yeah.
And what about your pets?
Yeah. So pets are definitely going to be susceptible to it too, and they're probably going to have more ticks than the humans, because they're not going to be able to communicate or tell you that they have one. But that's a good indicator as well, that if you're finding them on your pet, then you need to check yourself too, because you're usually in the same yard.
Exactly. I was going to say they can come to you from a pet.
They could crawl there and get on you as well. So that time period for Lyme disease, that risk gets a lot higher after 48 hours. But the good thing is about 75% of folks that get bitten by a deer tick remove the tick within 48 hours.
Right.
So that greatly reduces the risk.
Let's talk about that, Thomas. Now, I've heard so many people say, I don't know if it's a myth, but how do you safely remove a tick? Because I have heard so many people say, don't pull it off. I mean, what do you do? How do you get it off?
Yeah, the best way is just to simply have some tweezers and pull it off.
Okay.
Is the best way for somebody at home.
Okay.
Now, if you're at the hospital or the emergency room, sometimes they'll actually use soap and water.
Right.
And they'll kind of go in a circle movement, and it'll fall off. But the problem with that is at home it might not be effective if you've never done it before.
Right,
so typically the best way is to just go ahead
and just pull it off.
Pull it off all uniformly, all at one time. You don't want to pull half of it off. You want to pluck it off, and then you want to get rid of it immediately.
Right.
Not drop it. It might get on you again.
Exactly.
But that's the best way to do it. And then you want to immediately clean the area. Alcohol is a great way to just immediately clean that area. Soap and water is great too. But alcohol will kill the bacteria immediately. Soap and water is more of you got to make sure you get enough friction on there, because that's actually what kills bacteria with soap and water. A little side note is not necessarily the soap, really. It's the friction. It's
wow.
That's why everybody says wash your hands for 20 seconds.
I always learn so much when you come. Wow, that's something we don't think about.
Yeah, so the soap does help kind of disrupt some of the bacteria. Frequency and duration is key, and getting all over the area. So, but Lyme disease, as far as signs and symptoms, say you didn't catch the tick, 48 hours. It's been 3 days, and you're wondering, I have some fever, or I have some pain, joint pain. So some of the subjective symptoms that are really broad are the fatigue, the pain, the muscle and joint aches, headache, but they can be tied to a lot of different things. So that's the difficulty there. But the more objective physical findings, a rash, facial nerve palsy, redness, swelling. So the rash is what we've got to kind of really pay attention to.
Okay.
And so if the rash is, a lot of people say bullseye rash. That's what they're thinking.
Okay.
But that's, have you ever heard bullseye rash?
I have.
It's actually not many cases have that. So folks don't need to think that's always Lyme disease. It's usually just a uniform growing red rash.
Okay.
And so if you see that, you need to talk to your provider. And that's 90% of cases have a red rash that increases in size.
Wow.
And so that's key to look at. But later stages of Lyme disease can cause some pretty severe issues, like pretty severe arthritis, heart issues, inflammation of the brain, and spinal cord. Can be deadly. So you want to catch it quickly. Treatment-wise, fortunately, there's some antibiotics that are very common that can treat it.
Right.
But it's key to go ahead and get on it before you have some severe symptoms. And there's antibiotics that treat Rocky Mountain spotted fever as well.
So if you have any symptoms you're recommending of Lyme disease, you're recommending to go ahead and see your physician.
Yeah, and you can make the argument.
Try to be proactive.
Yeah, that if you have a tick bite, and you can definitely call your pharmacist or provider, and we can kind of walk you through what to do. But usually there's no issue. But if you start having symptoms, definitely don't want to ignore them.
Right.
Because
exactly.
it could lead to something more severe. And so prevention-wise, going back to what we talked about, it's hard to avoid at times, but you want to avoid walking through tall grass, uncut fields, or brushing up against vegetation.
Yes.
Bug spray
Yes.
is effective against ticks, not just mosquitoes.
They probably don't like the smell of it.
Yeah, so 20 to 30% DEET bug spray is effective. There's also picaridin is an ingredient that you'll see, like Ranger Ready, which we carry at the pharmacy, is another option. Natural options will probably have lemon oil or lemongrass oil. Not quite as effective, but if you don't want to put the chemicals on you, that's an option. Long pants, light colored clothing so you can see the tick, but long pants will keep them off your body a lot of times. And then checking yourself every 2 to 3 hours.
Mm-hmm.
You get home from a trip to the woods or hunting or fishing.
Yeah, if you've been camping or something like that, hunting, fishing, like you said, check.
Yeah, absolutely. So check yourself is key afterwards, because if you can go ahead and get it off, you can greatly reduce your chance of having any bacterial transmission.
Right.
But always call your pharmacist. We're accessible.
Yes.
Come in, show us, and we can help you find some bug spray for next time. We can help you, guide you on how to clean it and how to treat the symptoms of at least the redness, irritation, and we can guide you on whether you need to talk to the doctor. So we're in the Boyce Willis Clinic Medical Park Pharmacy, 901 North Winstead Avenue. Our phone number is 252-443-7979.
Say that again, Thomas.
It's 252-443-7979. And we would love to help you and guide you on how to manage a tick bite, and something very common here in eastern North Carolina in the summer.
Absolutely. And don't forget what I say every time. It's a lot easier to access your pharmacist than it is your provider. I can promise you that. So you just walk right in.
Yep.
So
absolutely.
Anyway, and Thomas and his staff will be happy to help you. So, and again, located in the Boyce Willis Clinic building. So thank you, Thomas. This
Absolutely.
was really good
Yeah.
stuff.
Enjoyed it as always.
Yes, we did. And we'll see you back next time. We'll let you know ahead of time, as we normally do, what we're going to talk about. And we'll see you in 2 weeks.
All right. Thanks,
Okay?
Andrew.
We'll be back.